Hi everybody, it's Dr. Newman. Let's talk a little bit about recovery after breast augmentation surgery. And one of the reasons why I'm having this conversation is because there are many people advertising and marketing breast augmentation surgery as something that has no recovery, has no scars, has no recovery. And I think that that's a little bit unfair. Breast augmentation, the way that it's typically done, and again, there's variations in how things are done, but for the typical breast augmentation patient, implants go in underneath the muscle. Muscles are not happy having been handled and pulled and stretched, just as you have to do when you do breast augmentation surgery and have to make a space for that implant. So there is a bit of a muscle recovery after breast augmentation. And when I do breast augmentation, typically when I speak to my patients, it's about 24 to 36 hours of them really feeling a lot of discomfort, especially when they cough, which sometimes happens after anesthesia, or sneeze, even take a deep breath. Sometimes it's sore. It's not unbearable, but that's why we give patients pain medicine, and that's why I hope that patients will use that if they really need it. But pain medicine isn't anesthesia, and there is some soreness for that first day or day and a half. But what I find is that beyond a day and a half, that discomfort really changes. And patients, if I do their surgery on a Friday, they are routinely back to work by Monday. Not without discomfort, but they feel like they can be pretty much back to a normal routine in a day and a half. They'll still have the soreness in certain situations. If they sneeze or they cough, it's still going to be sore, but it's still surgery. And I don't want anybody to think that breast augmentation isn't surgery. It's not just a procedure that you have done and you go on your merry way. There is a recovery, and it's important that patients understand what that recovery is. But beyond that day and a half or so right after surgery, patients are back to a normal routine. They're back to work typically. I pretty much will ask patients to kind of rest their upper body a little bit. So if you're used to going to the gym and you like to do upper body exercises, those are the kinds of things that I'm going to ask you to kind of take off for a week or 2 weeks before I really want you working out that muscle. The reason why the muscle hurts when you do breast augmentation surgery is because you're handling it, you're manipulating it, and what that really means is that you're damaging it a little bit temporarily, and it has to heal. And if you don't let it heal, it'll continue to be sore for a longer term. So it's just not smart. Respect the fact that this is surgery, and with surgery, there's a recovery. And if you follow the instructions that I give you, we've done this thousands of times. You follow my instructions, things will happen the way that I tell you that they'll happen, and things become very predictable. So in general, I'm finding that patients of mine that recover after breast augmentation surgery, they're recovering in a very consistent way. And it's really predictable as long as you follow the rules. So my suggestion to patients is please don't fall into the trap of feeling like you're going to have breast augmentation surgery and then not have to recover, because you will have a recovery and you really shouldn't be disappointed by that. That's expected and it's normal. But follow the rules and do things the way that they're supposed to be done, and you'll get the results that you're supposed to get. And that's the whole idea behind this.